Dr. Moshe Dekel. I want to introduce you to everybody. We're very honored and excited to have you as part of our team. Dr. Dekel has 20 years as an OB-GYN and 25 years as a functional and holistic doctor, specializing in hormones and functional medicine. Can you tell us a little bit more about yourself, Dr. Dekel?
Sure. Well, first of all, it's great to be here. Thanks for inviting me. As you said, I'm board certified OB-GYN. I did it for about 20 years, so delivered a lot of babies. But back in 2000, so it's about 25 years ago, I changed course. And a lot of my patients ask me, what made you change? And I tell them, I'm not aware of any doctor that wakes up one morning and decides from here on I'm going to be holistic. Yeah. There's always a personal story. My personal story is that my neck and back, after 25 years of doing surgery, looking at the operative table, my neck said, you're out. So I was lucky enough, instead of looking at the door just closed in my face, to look for another door. And I'd like to call it the door to real medicine. I really had to go to my second medical school and learn all this, because they don't teach us this in medical school or residency, anything. I learned, and I actually never looked back, because this holistic medicine is so fascinating and so wide that you never finish your learning, so to speak, but you get enough information to be able to change people's lives. And that's what we're doing. A lot of us stare at the door just closed in our face and say, what are we going to do? Well, the universe is telling you do something else and find what it is.
But were you scared initially?
When you use the word scared, I was concerned, because I didn't see myself doing just pap smears the rest of my life. Not that there's nothing wrong with it.
Right.
But I need a little more challenge than that. A lot more challenge.
Right.
The first modality that I came across was breast thermography. And I said, breast thermography, what is that? Well, it's using an infrared camera to surveil the breast. And I said, well, if it's so good, how come I didn't hear about it? It was my first question. And then I looked into it and I said, wait, this is no radiation, no compression, no increase of risk of cancer just because we do the test. Mm-hmm. I said, I need to learn about this. So I got certified in it. That was the first modality. Now, I used to use hormones as a conventional OB-GYN, but the wrong hormones, actually. Meaning, not the wrong, but not the natural and bioidentical ones. So, I read a lot. I met with doctors who were more experienced than I am, attended a lot of conferences, and over the years accumulated enough knowledge to actually be able to deal with any problem, medical or preventative or longevity, for men, women, and I have also children in my practice. Oh yeah. I deal with ADHD, autism, unfortunately. Yeah, it's what I think should be. In other words, you have a problem, tell me what the problem is, I'll find a solution. I'm not talking about giving you a prescription drug that doesn't work, has a lot of side effects. I'm talking about, okay, what's the basis? Where's it starting from? Mm-hmm. Okay, so instead of, where's the fire? Where's it starting from? And a lot of it has to do with what? Lifestyle change, which is, by the way, the most difficult one for people, because we don't like to change.
No.
And I say, I can show you how to get there, but I need you to make also some changes. I actually asked them, how committed are you to getting better? And it's kind of interesting, they have to think about it. They say me after they've seen 5, 6 doctors. No doctor says, how serious are you to get healed? Because unfortunately they don't heal. Mm-hmm. They don't heal. They kill symptoms.
Right.
On the best case scenario, but not without any kind of course, side effects. Mm-hmm. And I gauge their commitment. And I don't have any problem with low commitment or high commitment. I just need to know how to approach their goals.
You move at their pace.
That's right. Like the patient we saw the other day. Yeah. When she told me right off the bat, I'm not going to change my sugar. I'm not going to change my, what else she had a problem with? Coca-Cola. We're not giving up on these patients. What we need to do is give them enough direction to get them better to even some degree. And then they get enticed to say, wait a minute, if I stop my bad habits, I'm going to completely heal? And the answer is yes. Because the body is a miracle. Give it what it wants. Give it what it wants. You know, it's kind of interesting because if you look at the meaning of doctor, where's the word coming from? It comes from Latin. It means teacher.
Really?
Well, how many doctors teach you? They don't have time to even finish a conversation. I mean, you see them for 6 minutes, then time is up.
Yes.
So we're actually here to educate our patients and to let them participate, at least what I'd like to do, is let them participate in decision-making process. Because if we give them something they're not ready to do, it's not gonna work. And I tell them, you know, that's what you need to do. How comfortable are you? To what degree can you do that? Let's assume lifestyle, okay? Are you willing to look into keto recipes and say, I'm not giving you a diet, because diet, nobody can pursue for too long. Too restrictive. But I say, if you look at keto recipes and you have 200-300 recipes that actually taste good, look good, and are healthy for you, will you be willing to look at that? And very few people are going to say, no, I'm not willing to. So you kind of ease them into this modality because that's the first time they came across this. What they used to. 6 minutes, have a prescription, have a nice day.
But I'm seeing that there's more of a shift of people wanting to become more conscious of their health and become healthier. There's certainly a movement.
Absolutely. If they were not sitting here. They go to a conventional doctor, get a medication, and continue to be miserable. So obviously, a lot of my patients coming in, I ask them, is this your first visit to a holistic doctor? I would say 50% say yes, even more. We have to ease into it, as you said.
Right.
Because if you go too forceful, there's a little hesitation. I mean, this is too radical. It doesn't really work. It doesn't really work. You know, if this works, how come my other 10 doctors didn't say it works?
The whole paradigm shift.
It's a definitely paradigm shift.
So I wanted to talk to you about something that I'm going through.
Yes.
Which is perimenopause. And, you know, it kind of caught me by surprise because I kind of feel like at times I'm...
They jumped on you. It's like, oh, I'm here.
Yes. Yes, like my body has been hijacked and...
Where's it going?
Yes, I don't know. The brain fog, my ADD, it seems like it's out of control, very low libido. I just don't feel like myself, low energy, and days where I feel very down and depressed. So are these signs, we have talked and you said these are hormonal issues, right?
Right. It's a great question that all women have to deal with. Mm-hmm. If they don't have any, you didn't mention hot flashes because not everybody has hot flashes. But most of what you just described is definitely the majority of women who enters their late 40s, early 50s. They have to face it one way or the other. You're absolutely right, because they feel like they're losing their mind. It's like, what happened here? I was fine yesterday. And it's interesting because it can creep on you slowly, or it can really shift and say, what's going on? Nobody can predict how fast it's going to happen. But the earlier you address these issues, you can get back to what we call normal much faster. So just to explain, as we get into our 40s, and maybe even before, our progesterone starts to go down. So the ovary produces less progesterone. Now, a good regular cycle depends on a ratio between estrogen and progesterone. For instance, the first 2 weeks of a cycle, you have just estrogen. You ovulate around day 14, if we're looking at a 28-day cycle. Estrogen starts to slow down a little bit, and then progesterone shoots up. Okay, so if you take a ratio of estrogen and progesterone on day 23, 24, you're going to have about 100 to 200 times more progesterone than estrogen. Mm-hmm. Why? Estrogen is a very strong hormone that actually is a growth hormone. It tells your breast, get ready for pregnancy. It gets the uterus, get ready for pregnancy. Progesterone matures the tissue Make sure there's no overgrowth because that's not good. If there's no pregnancy, both hormones goes down. Now you have a period. And that's a normal cycle. But as progesterone goes down towards the 40s and 50s, the ratio changes, and now we're open to what? More PMS. What we have is really what we call estrogen dominance, okay, because there's less progesterone, so the ratio is favoring estrogen. Irregular bleeding, missing periods, bleeding in between the periods, libido starts to go down, sleep is start to be disturbed with. As a result of no sleep, all of a sudden you feel tired, you're fatigued, brain fog, if you don't sleep well.
Yeah,
Okay. And that's assuming that that's the only abnormality that happened. We're talking about just one hormone. Other issue you talked about, brain fog, doesn't have to be just that. It may not be just because of lack of one hormone. The brain fog can be related to thyroid function. Also, the energy level could be related to that. We mentioned gut. Well, how's the digestion? So we need to think of, okay, how do we make energy? Obviously, it's with the food that we eat. But let's assume we eat correctly. Are we digesting correctly? Are we assimilating the nutrients correctly? Are we burning it correctly, deriving the right amount of energy? For instance, the thyroid hormone speaks to every cell in the body and tells it how much energy to make. What if we are under par in that category? We're not going to make enough energy, so we feel fatigued and brain fog. The brain consumes 20% of our daily energy. Another 20% digestion. Digestion is very demanding as far as energy is concerned. We look at holistic. What does it mean? Holistic means the whole. So it's not just, okay, you come to me and you say, well, my low libido and my periods are totally crazy and whatever. I say, here's some progesterone, have a nice day. I need to investigate everything else we just spoke about.
Everything's connected.
Everything's connected. And as holistic doctors, I believe we have one chance at this to make it better. Even a small amount. Because the people that come to us, they come to explore. They really, after seeing so many doctors, they don't believe that it could get better.
They lose hope.
They lose hope. So we cannot absolutely afford another no hope. And I tell them, listen, you do what I tell you to do, you're going to get better. You don't, you don't. They come to us because they're looking for solutions. So even if we get 20%, because there's a lot to it, the lifestyle and everything else, as we spoke about. But if we get just a little better, say, I feel more energy. There's hope. And once they see that, then the road is open.
It builds momentum.
It builds momentum, and now they say, well, the more I invest, the more I get. Exactly.
Dr. Dekel, what can I do because my libido is way down?
That's a great question, and not too many people know about this, but this can be fixed very easily by somebody who knows what they're doing. It's usually fixing your hormones, okay, digestion, lifestyle, and it's not difficult. So don't give up. We can show you how to do it. Libido in women are depending on two different hormones. One is DHEA, which is adrenal, which can be supplemented, and the other one is testosterone, which can also be supplemented. And it's not too difficult. It comes in a cream. You apply it to the clitoris at night, and within few weeks, your libido is going to be much, much higher.
And now I heard that too much testosterone can make my hair fall out. Is that true?
Well, in order for you to have that much testosterone to have your hair fall out, before that you're going to have facial hair, your voice is going to be more masculine, you're not going to feel right. And the way we do it, we always go on low, safe dose until we get the clinical response. We don't spike, we do it physiologically.
Dr. Dekel, I always feel bloated. What can I do?
Well, it's another good question, because most people have the same issue. So what we do is, of course, make sure your intake, your lifestyle is correct. And then we make sure that your digestion is correct by the right supplements. Hydrochloric acid for the stomach, digestive enzymes for the pancreas, okay? Make sure the colon is supported. Make sure that we address the leaky gut. And again, it's not complicated. We can do it in a few sessions. We'll change your life completely.
Dr. Deckel,
Yes, ma'am.
I don't want to take 100 supplements. I really have a hard time swallowing a lot of pills. If you had to narrow it down to maybe 3 or 4 supplements, what would you say are the most important ones for me to take?
Again, I hear this a lot. The main issue is, do I need to take it the rest of my life? It's really frightening people. Do the basics on it. It's thyroid, adrenal, gut. That's the basics.
Thyroid, adrenal, gut.
Yes, so that's the basics. Because that will get you the digestion where you want and the energy where you want. But then let's not forget sleep. So it all depends. Again, the majority of patients can get by with maybe 6, 8 supplements, not more than that. But again, as they get better, they might say, well, is there anything else I can do? Well,
And they want more.
And they want more. But the thing is, you see, once they get return on their investment, then they're open.
Dr. Deckel, you had mentioned adrenals. Can you explain more about that, the importance of it?
You know, I'd like to call it the neglected gland.
The neglect.
The neglected gland.
Yes.
Because why? In conventional medicine, it doesn't exist unless you have completely overboard or completely shut down. And if you're shut down, you end up in emergency room. Most of us have adrenal stress, okay? And the adrenal works together with the thyroid, okay? So if you have a lot of stress and now your cortisol goes up goes up what? Your immune system goes down, number one. Number two, you develop abdominal fat, which a lot of women complain in menopause, etc. So we assess the adrenal glands and we actually support it before it gets into the zone of, my goodness, what's happening to me?
And that can be treated with supplements or with prescription medication?
With supplements. We don't use prescription medication.
Okay.
Unless your life depends on it, and that's not the case. So absolutely. It's lifestyle and really supplementation. It's sleep.
So how many
Nobody
hours
talks
of
about it.
sleep would you recommend for people?
At least 7. You know, in holistic medicine, by the way, sleep is more important than food. You say, wow, really? Yes. We can survive without food for weeks, as long as we have water and electrolytes. We cannot survive sleep without more than 3 days. We die. 3 days max. It's very, very important. And insomnia is a major issue in our society. The hot flashes, going back to hot flashes, 50% of women will have it. Well, how do you address it? Bioidentical hormone replacement, both estrogen and progesterone as needed, stops it right there. And then stress, and then bladder issues, etc. You need to give them some supplementation, natural, like valerian root, like melatonin. I like to use melatonin spray because it absorbs right under the tongue, on the mucous membranes. So it goes to the brain right away. It doesn't depend on what? On absorption and digestion, etc. And you don't have to open a bottle, take a pill, take water, spill the water, and now you're totally awake. So there's a small little thing, you spray, and the next thing you know, it's morning. So that's extremely important.
And what about for people that get groggy on melatonin the next morning? Do you have an alternative?
I have, the number of people who get groggy melatonin is so small that I don't recall in my practice that I've encountered it. And if I did, what I do is I change to CBD, valerian root. I have different types of sprays that for those who melatonin is not working for some reason, then we can use the other sprays. But that's extremely important.
Dr. Deckel,
Yes, ma'am.
my husband's libido is low. What can I do?
He needs to sit down here and I'll talk to him. But anyway, we have a lot of men in our practice that start to have libido issues way before 50 or 60. We have patients in our practice that actually need testosterone supplementation as young as 30.
Wow.
Yes. So let's start with the fact that men lose testosterone to the tune of 1 to 2% per year from the age of 25. So by the age of 50, you may lose 25% or 50%, depending on 1 to 2%. And we really don't know because we don't check testosterone in men in 20s. So we really don't know. Another issue is the lab values. It varies. Let's talk about total testosterone now. Changes anywhere from 200 to 1200. So 201 is normal and 1199 is normal. It doesn't make any sense. So I deal with it. Of course, I do blood tests, etc., to see where they are. But mainly, I see where they are. If their libido is down and they talk about it, the next question is, do you have a spontaneous morning erection? If they don't, I really don't care what the lab says. They're deficient. They need supplementation. Now we can talk about supplements of, do you give just testosterone? Do you give DHEA? Do you give other remedies to, like urine chorionic gonadotropin, etc., to stimulate your own production? That's more kind of broad spectrum. But absolutely, this can, usually within 6 weeks, their libido will go up. Now, if they have erectile dysfunction, that's another discussion. For that, usually we use Cialis. I like Cialis because it's very few side effects. It works for 24 to 36 hours, sometimes 48 hours. You don't have to take it just before sex. You can take it well before. It's not a problem.
Can women take Cialis?
Yes, they can. Cialis is actually good for the heart. It's vasodilator. It's good for the bladder. For men who have issues with prostate, it works well with that. So all in all, it's a great supplement.
So if a woman takes it, what would she experience?
That's a great question. I haven't used it too much in women because when you give them the DHEA and testosterone, the libido is enough. They don't need to. But yeah, it causes vasodilatation. So, the clitoris is like a small little penis. It works the same way. Engorgement, blood supply. But libido in women, I would use DHEA and testosterone.
Dr. Deckel.
Yes, ma'am.
How do I know if I have leaky gut?
That's a great question. And not too many people know about this. But everybody has a leaky gut. Even me. To one degree or another. You say, what the heck are you talking about? My stomach is great. I don't have any symptoms. What do you mean I have a leaky gut? Well, let's explore this for a second. We put foreign materials in our body every day, meaning food, and we live to talk about it. How does it happen? Very complicated mechanism. So really, when you look at it objectively, there's a war in our gut 24/7 between the good and the bad. In other words, we need food to sustain energy and rebuilding and repairing, obviously to live by. But what's the side effects of digestion or eating the wrong foods or not completely right, not having the right bacteria in the gut, which most of us don't have? Our job is, and again, I don't want to make it too complicated, but we need to keep our gut in tip-top shape. And every time, and I tell patients, listen, we should not have heartburn. That's leaky gut. We should not have bloating. That's leaky gut. We should not have constipation. That's leaky gut. We should not have diarrhea, loose stools, IBS, anything. You say, well, what about Crohn's and ulcerative colitis? That's extreme leaky gut. And you say, what? Explain to me, what's leaky gut? Leaky gut means that the spaces, the junction between the cells in the gut have opened just very little. For us to see it, we need an electron microscope.
Wow.
But molecules are also small. So if it opens small gaps between the cells, stuff goes in, not supposed to go in. Molecules go in, not supposed to go in. Create what? Immune response. Inflammation. Once it becomes chronic, and now we have a boiling pot here of inflammation that can go any place. Goes to the joints, and now we have arthritis. You go to the brain, now we have what? Headaches. Goes to the circulatory system, what do we have? High blood pressure, heart disease, diabetes, you name it. Cancer. It starts with inflammation. Death starts in the colon, and it's absolutely on target. You want to live long, you want to live healthy, take care of the gut. And to be short, what does it mean? Eat right, digest right, assimilate right, eliminate right, and all this needs lifestyle and supplementation.
Well, thank you, Dr. Deckel, for your time today. It's been very informative, and very happy to be able to help people with their gut issues, their hormone issues, and lifestyle issues. So thank you for your knowledge.
You're welcome. Thank you for inviting me. I believe that education is paramount.
Yes.
Because I believe one of our main function as holistic providers is to really educate the people to know that they can do different things empower them to actually investigate it, read about it, educate themselves about it, and act from knowledge rather than from fear, which is, in my opinion, conventional medicine. They're great in fear. We don't do that.
Right.
So thank you for inviting me.
You're welcome.
I'm looking forward to the next session.
Yeah.